Hi, my name is Roberto, and I have bulimia nervosa.
My name is Lauren, and I have been diagnosed with bulimia nervosa.
Bulimia nervosa, derived from bos cow and limos hunger, which metaphorically translate as having the hunger to eat an ox. It is an eating disorder not necessarily characterized by self-induced vomiting or by a body mass that is more than severely underweight. Due to this, there are far lower mortality rates than anorexia nervosa, which requires that the person is severely underweight. Bulimia is usually accompanied by guilt, shame, and self-deprecation, rather than a distorted perception that is accompanied with anorexia nervosa. Bulimia is defined by periods of uncontrollable binge eating that may, but not necessarily, be followed by self-induced vomiting in order to maintain or lose body weight. Abuses of diet-related medications and/or extreme exercise are other common maladaptive behaviors that are indicative of this disorder.
According to the DSM-5 criteria, to be diagnosed as having bulimia nervosa, a person must display recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following. First, eating in a discrete period of time, for example within any 2-hour period, an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances. Second, a sense of lack of control over eating during the episode. For example, a feeling that one cannot stop eating or control what or how much one is eating. The person must also display the following. First, recurrent inappropriate compensatory behavior in order to prevent weight gain such as self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting or excessive exercise. Second, both the binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. Third, self-evaluation is influenced by body shape and weight. The disturbance does not occur exclusively during episodes of anorexia nervosa.
Hey, are you ready for the test tomorrow?
I've done like some reading and everything, but I haven't really done a lot. But I've got a class to take at the gym.
Oh, I thought I just saw you there.
Yeah, but I'm doing 2 days. Like I've got to go.
Okay. Hey, are you feeling okay?
Oh, yeah, I just got the bug going on.
Oh, you looked a little down in class today.
Oh, yeah, I just sick or whatever, but I gotta get going.
Okay. Bye. Have a nice day.
Yeah.
The DSM-5 has changed some of the criteria from the previous DSM-4. While the DSM-4 specified a minimum of 2 binges per week, the DSM-5's modified once per week criteria has shown to be just as prevalent and is still a telltale sign. Another alteration is that amenorrhea, or an abnormal absence of menstruation, does not need to be present, as some people are more physiologically resilient to starvation. People suffering with bulimia nervosa are commonly shown to have a high comorbidity of mood disorders, including major depressive disorders, anxiety disorder, substance abuse disorder, social disorder, obsessive-compulsive disorder, and panic disorder. The exact cause of bulimia nervosa is unknown, but scientists agree that the onset is due to a number of factors. 3 main factors include social pressures, family factors, and biological causes. When multiple factors occur at once, the chances of developing bulimia increases. Social factors, like the pressure to be thin, is a prominent risk factor for bulimia. It is seen everywhere from TV to magazines. It is even seen in Disney cartoons, for example, the Disney princesses. The pressure to be thin leads to dieting, and failed dieting can lead to shame and then the act of purging. Family factors also play a role. It has been shown that parents who are controlling and are perfectionists put significant pressure on their children, who then put too much pressure on themselves. Maladaptive parental influences to a child's physical appearance or body weight also leads adolescents towards negative body attitudes. Lastly, biological causes are not seen to be as prominent, but in one study it was shown that children with parents who have depression, anxiety, or eating disorders themselves are more likely to develop an eating disorder, such as bulimia.
Treatments for bulimia nervosa include cognitive behavioral therapy, enhanced cognitive behavioral therapy, group therapy, prescription antidepressants, and hospitalization, which is not always necessary. The average age of onset for bulimia nervosa is 16 to 20 years old. The 12-month prevalence is 0.3% of the U.S. adult population. The lifetime prevalence is 0.6% of the U.S. adult population.
With a high comorbidity of mood disorder, antidepressants are usually the most appropriate medication. Cognitive behavioral therapy is shown to be most effective despite few cases of full recovery under all treatment protocols. Research in newly developed individualized cognitive behavioral therapies show early signs of promise in promoting effectiveness and recovery. Diagnostic crossovers of other eating disorder subtypes are accounted for in individualized treatment protocols.
So what do you see when you look in the mirror?
I just see a fat person, just really big hips, fat all over, can't really stand to look at myself. I just don't want to look anywhere other than down, just don't really want to see myself.
So how have you been feeling?
I mean, I'm okay. I'm just not really happy, with how I look. I'm not comfortable in my own skin.
How are you handling that?
I mean, I've been exercising 2 to 3 times a day, and I just do a lot of working out, and I don't know, I'm trying to keep up with this diet, but I end up starving myself, and then when I'm starving, I'll end up eating at night when my roommates are asleep, and I just binge eat, and then I just feel really upset. So then the next day, I have to go work out 2 to 3 times so I don't gain that weight, and I've just been doing this for a really long time.
So what made you want to diet like this?
I mean, when I got to school, everyone was so freaked out about the freshman 15, and there's so many pretty girls here, and I just kind of freaked out and didn't want to get the freshman 15, so I just kind of changed my entire behavior of eating and working out.
If you or someone you know is having trouble with an eating disorder, help is available. Local resources include the Cal Poly Health and Counseling Services, Pulse, and the Community Counseling Clinic.